The number one thing that you can do for yourself is exercise. And when I talk about exercise, I actually try not to use that term. I try to talk about activity because I think exercise can be a little daunting. And I remind patients you do not need to get a gym membership or a gym outfit or even gym shoes.
Right.
You can just go on a walk.
Welcome to Made in God's Image on Nashville Catholic Radio, brought to us with our friends at Ascension St. Thomas. And we talk about how we can take care of our body, mind, and soul that God gave us. And we'll begin this episode with a quick prayer. We have a cardiologist from Ascension St. Thomas to join us in just a moment. But let us pray. In the name of the Father, and the Son, and the Holy Spirit. Dear Lord, please open up our ears and our minds to listen to the expertise that we have in front of us so we can take good care of ourselves, so that we can take care of those around us and our brothers and sisters everywhere. Please bring us enlightenment and bring us the understanding that we need to make the most of our lives through taking good care of ourselves. In this we ask. In Jesus' name, amen. In the name of the Father, and the Son, and the Holy Spirit. So we have Dr. Fish-Trotter, who is a doctor of cardiology and internal medicine. Thank you for joining us.
Thank you for having me.
You are at Ascension St. Thomas, and obviously you're dealing with all things heart. Walk us through a typical day for you.
Sure. Well, first I wanted to just point out that you are having me on Go Red National Wear Red Day for Go Red for Women, which is the national campaign from the American Heart Association to raise awareness for stroke and heart disease in women. And so this was a very timely day to meet. So,
Excellent.
And I'm wearing my red for Go Red Day.
I wish I remembered.
But a day in my work day, typically, so I focus on women's heart and also cardio obstetrics. And so that entails taking care of patients really across the spectrum of a woman's life. I also take care of men as well. But a passion of mine has really been to focus on cardiovascular conditions in women, which of course often entails helping women through a period of pregnancy, as often that's a part of our life phases. So
yeah, that's fascinating, because dealing with somebody who's having any kind of cardiology issue and is carrying a baby, I would imagine complicates things immensely.
Yeah, so there's been a lot of focus on really understanding, how to best take care of women, both who have a history of cardiac condition prior to pregnancy, or maybe who have cardiac complications, or maybe just concerning symptoms that could be related to the heart that arise during pregnancy. And so that field of focus has really grown over the last several years. And another area of focus I think that we're starting to appreciate in cardiology is that a woman's medical history surrounding her pregnancy, even if that was years ago, has relevance to her cardiovascular risk later on in life. So we know that certain complications in pregnancy, such as preeclampsia, eclampsia, even just gestational hypertension or gestational diabetes, does carry a risk of cardiovascular disease, actually up to twofold. And so a lot of times we don't really necessarily talk about how are your pregnancies. That seems like a remote, maybe irrelevant question, but we're really starting to recognize the importance of that history, especially if somebody says, oh yeah, I had actually 3 pregnancies and they all had, several complications. We know that we just really need to be that much more alert and aware of when we're doing cardiovascular risk stratification and assessment for that woman. Again, even if she's beyond her childbearing years. So it really covers the gamut of a woman's lifespan in cardiology.
With some conditions, some can be more often associated maybe with one gender or some other demographic. For cardiology issues, it seems to me, and tell me if this is true, that it's always been kind of the same for both male and female, that they both have to worry about it equally.
Yeah, so I think that's a great point, because I think there are some misconceptions surrounding that, the differences between men and women. So you're right. I think on the one hand, we have maybe in the past under-recognized, and studies have shown that we have under-recognized heart disease and risk of heart disease in women. In fact, there are some studies that showed that, a woman with a heart attack is more likely to die of that heart attack than men, which I think really raised awareness and a focus on recognizing risk, both from the provider perspective, when you have a female patient coming in with symptoms and complaints, to really, keep in mind that women have these risk factors for cardiovascular disease too. In fact, cardiovascular disease is the number one killer in women in the United States. But I think on the other hand, there are some cardiac syndromes and diseases that are more prevalent and specific to women, and that would include certain types of heart failure that we call diastolic heart failure. Things like microvascular disease, which we're really starting to have increased awareness and understanding on, is more prevalent in women and has been sometimes a challenging diagnosis and often under-recognized diagnosis, just because a lot of women will be presenting with chest pain, but they'll have a cardiac cath or they'll have testing that comes back as normal, but their chest pain is real. Sure. They truly are having angina that does, have associated risks with cardiac outcomes. And so another kind of female-specific condition would be spontaneous coronary artery dissection. And so there are some differences between men and women in terms of which cardiac conditions are more common in men versus women. But again, I think that we don't want to go too far in saying men and women are different, because, again, we want to also recognize that heart disease is the number one killer in women, and heart disease is thus very common in women, and we want to be on alert for those, both from a patient perspective and provider perspective, when a woman presents with symptoms that could be representative of a heart attack or heart disease.
Right. If somebody is watching or listening to the program now, is there anything that, before they get to a doctor, would be something that tells them, I need to look into this, I need to probably have a test done or talk to my, primary care physician?
Yeah, so I think that's a great question. So one thing that I try to emphasize with my patients is, again, going back to that obstetrical history. Sometimes they kind of look at me sideways, like, why are you asking me about my pregnancies? I'm not at the OBGYN office. But, I just kind of quickly explain that we do know some conditions and complications in pregnancy have associated risk with cardiovascular disease. Just as, we would ask a family history, do you have anyone in your family that died of a heart attack or had a heart attack at a young age or died suddenly? And so similar to, a relevant family history being a risk factor for you, your obstetrical history can potentially raise red flags that you have some risk factors that we maybe would not have otherwise known about. And so I would say, if a woman is listening to this and has had several complications in her pregnancy, such as, preterm birth, gestational hypertension, preeclampsia, gestational diabetes, it just means that, it's all the more important to make sure that you at least have a primary care physician that you see and have your annual screening for your blood pressure.
Right.
And make sure that your cholesterol and your diabetes screening tests are performed. A lot of times women have this touch point with the healthcare system when they're pregnant, and that's really an opportunity to recognize whether they, are at increased risk and need some additional screening following the pregnancy. And, really, a lot of times we may not see that woman again for several years until she maybe is going to engage with a primary care physician.
So would you recommend advocating for yourself if, say, you've had a baby and now that, we're discussing this and we know that, that, is sometimes a precursor to another condition.
Yeah.
What would they... I guess we're all looking for the words. What do I say to my doctor? Yeah,
I think just making sure that you have a physician that you are routinely seeing for your routine screening, such as a primary care physician. But if you have a number of cardiovascular risk factors, potentially in your family or other sex-specific risk factors, which by that I mean risk factors that we see more commonly in women than men, and that might be autoimmune disease such as lupus or rheumatoid arthritis. Those are some additional risk factors that are not traditionally, assessed in our cardiovascular risk calculator tools that we've previously used to say what is your risk of heart disease. If you have that history, I think considering whether you need some cardiovascular risk stratification. I see patients that will come to me and say, I don't have any symptoms, but I've had 2 family members just had a heart attack and now I'm concerned, or I've started noticing my blood pressure is kind of creeping up, and I want to know what's my risk for cardiovascular disease and what do I need to do to really aggressively reduce that risk.
Right.
And then on the other side, the other side of things, if you do have symptoms, I think just making sure that we are aware that cardiovascular disease does occur in women. It's not, if you're a woman, don't downplay those symptoms. If you're starting to feel a little bit of chest squeezing, chest tightness, or maybe not even having those symptoms, but having some shortness of breath that you didn't used to have with, a certain level of exertion that you previously could perform without those symptoms.
That would be a flag,
Yeah, just listening to your body and recognizing, not diminishing or dismissing symptoms, especially if you're seeing changes in your stamina or maybe changes, in your kind of daily activities. I think just recognizing that there is risk of cardiovascular disease and stroke in women, and we want to take those symptoms seriously so that we can investigate them and make sure that nothing more is going on.
If you're just joining us, this is Made in God's Image, Nashville Catholic Radio. I'm Jim Crow. I'm here with Dr. Fish-Trotter from Ascension St. Thomas, and we're talking about heart health for the month of February and for the whole year long. But we're going to focus on it here. And I'm curious if one of the concerns, there's a role that, women traditionally will have of taking care of the people around them. Even if they're not a mother, it might be an elderly parent or, maybe some other family member who's got things going on. And they will focus so much of their time, energy, and attention on making sure that they're okay. Is there a risk that you could be ignoring your own symptoms or flags that say, hey, something needs attention, for women?
Yes, I think that definitely occurs. I mean, I'll frequently have patients in my office and they have brought their spouse, they brought their wife, and, it's their wives that are telling me he's not being honest with you. Or patients come with their mothers sometimes. They really are caretakers for the whole family. Mm-hmm. And I think what, Go Red for Women month is really trying to emphasize is that it's time for women to also take care of themselves and recognize that there is this increased risk in women. And so, listening to any symptoms that arise, knowing that there are some cardiac conditions that are more common in women that we maybe don't traditionally think about. Most people usually think about heart disease. They think about, heart attack. And there are other conditions that we see in women, certain types of heart failure, as we're discussing. And so if you're having leg swelling or you're having a reduced stamina, shortness of breath, there could be signs that you maybe need to be evaluated and to make sure that you are taking care of yourself as well so that you can take care of all those family members too.
Right.
I do have women come in whose husbands and male partners or male family members are also advocating for their health as well. So I don't want to imply that the opposite isn't true. But
yes, but guys can't be off the hook though. Mm-hmm. I want to be equal here because men will often discount their own health problems. Yes. I don't want to go see a doctor. I don't want to hear the news. Mm-hmm. It's fine. I'll cowboy up and I'll just get through this. Yeah. So, those people, obviously, can't ignore those things. But I love your idea of the people around that woman who may recognize those symptoms and those problems, or may know the history of the family, can be the one that give that person that nudge, saying, hey, this has been an issue. This is something you should talk to your doctor about. Yeah,
it's often the people around us, I think, that notice some changes maybe more than we even notice in ourselves. And they notice that, that flight of stairs is really, you're really having a harder time going up the 2 flights of stairs at home than you used to, or you used to walk. We used to go on walks and you're wanting to go shorter and shorter lately, or you're having to stop. And so I do think that the perspective of those around us can be really useful as well. But I think just making sure that, that's what I love about preventive cardiology is that really coming in, either if you just have significant history in your family or in your personal history that may or may not, be relevant to your cardiovascular risk. I think coming in on the earlier side of things and, maybe you think that this is nothing, but you're just not sure. That's really the opportunity to try to prevent disease progression or prevent disease development before we see you in the hospital and have something really serious going on.
Right.
That's the opportunity both for, women and men, but women beyond their childbearing years, we can, risk stratify and work on cardiovascular prevention, but also women, if they're younger and they're anticipating pregnancy, but they have possible cardiac history or known cardiac history, really being proactive and seeing your cardiologist if you have heart disease or if you have symptoms that are concerning, discussing that with your either primary care or possibly a cardiologist ahead of pregnancy can really be a really opportune time to make sure that we enter pregnancy, at optimal health and with the best strategy for a healthy mom and healthy baby. So prevention is always the key.
Yeah, put it in with those things that, you normally would if you are anticipating having a baby, getting your vitamins, your folic acid, you're not having any drinks, all those things that you do, you could focus on your heart as well and making sure that everything's fine in that department as well, right?
Yeah.
Add that to it.
Yes, absolutely. So, and like I said, if you have cardiac history, it's, of utmost importance that you use that time to re-engage with your cardiologist and have a discussion with them that you're anticipating pregnancy and you want to talk about A, your risk, but B, how to get healthy, how to make sure that your heart is as healthy as it can be. That's really our preferred way to help women get through pregnancy and approach pregnancy. With the relevant history, or you have a history maybe in your family and you're wondering if it's safe to pursue pregnancy if you're at risk for those conditions as well.
Let's talk a little bit about what we can do proactively.
Yeah.
Okay. So I think we tend to have short-sighted, visions of our health. Like, I'm fine now. It's fine. It's not a problem. But what are some of those things that we can do to lessen the likelihood of having cardiology problems down the road?
Sure. This is one of my favorite topics, too, to talk about with patients is, what is going to increase our likelihood of longevity and leading a good and healthy and long life that has a good quality of life as well.
Yeah.
And that conversation can begin, at any age, but the number one thing that you can do for yourself is exercise. And when I talk about exercise, I actually try not to use that term. I try to talk about activity because I think exercise can be a little daunting. And I remind patients you do not need to get a gym membership or a gym outfit or even gym shoes.
Right.
You can just go on a walk. And so a lot of us, especially in the United States, are really having trouble incorporating movement and activity in our daily routine. A lot of times I'll have patients say, I don't do exercise, but I do get a lot of steps in a day at work, which I think is great. Obviously, more steps in a day has associations with reduced cardiovascular risk and all mortality.
Right.
However, the studies and research on exercise are usually on activity done outside of work, outside of running all of those errands. So I do remind patients that you will get an additional benefit if you dedicate even just 15 minutes. I usually say let's just start twice a week, maybe just on the weekends, and just go out on a walk. And usually patients, especially if they're there with their spouse, they look at each other and say, yeah, we should do that. That sounds kind of nice.
Right.
Especially as the weather warms
There's
up.
added benefits to it, not just your physical health, but your relationship health, and
emotional health,
mental health, and even on warm days in February in Middle Tennessee, warm days might be 50 degrees.
Yeah.
You're getting some fresh air, you're getting sunshine, you're getting to appreciate nature. There's so many side benefits that don't have to do with heart health that you'll probably enjoy.
Absolutely. I think just walking has, a multitude of holistic benefits, but it's the number one factor that you can do for yourself for increasing longevity, just because it does improve your cardiovascular health. It's also been shown to prevent dementia or your risk of dementia. It increases your strength and stability. And so especially as we enter older years, risk of falling and having a hip fracture, which can be really debilitating and associated with mortality. All of those risks reduce when you just increase regular activity, in addition to reducing your cardiovascular risk. The American Heart Association recommends 150 minutes a week, which I always mention, but then, backpedal that because that can seem like a lot if somebody's not doing anything right now. And just reminding them that any number of minutes minutes is going to add you significant benefit. If you go from 0 minutes to now doing just 30 minutes in a week, you've still greatly increased, benefit on all of those fronts that we just discussed.
Right.
And also reduce the risk of up to 13 cancers, which is something that I think usually
That's
kind
amazing.
of piques the interest of patients when I'm talking to them, because we think, oh yeah, I got to be heart healthy. But as we just said, reducing the risk of dementia, the risk of falls, the risk of, cancers is just, you can't overstate the benefits of
Right.
making sure that you stay active. And it doesn't mean that you have to go to the gym and get on a treadmill at all.
Sure. Yeah. I mean, if there are gym rats who just love it, and that's,
Yeah.
where they get their, serotonin, and, I'm just happy when I go to the gym. Then there's people like me. I see the gym as very boring unless I'm doing an activity I enjoy.
Yeah.
So, I play recreational hockey once a week, and I'll do this or that, or I'll play pickleball and things that will keep me active, but aren't necessarily the gym where I don't get enjoyment.
Yeah.
So I think there's ways I think we can find to achieve those goals of getting that elevated heart rate and that good workout.
Yeah.
While you're doing something you really love instead of a chore.
Yeah, absolutely.
Right.
In terms of other things that you can do for prevention and really reducing the risk of cardiovascular disease or other disease and mortality, the other thing I really emphasize is smoking. If you're smoking, you've just got to try to, stop with tobacco exposure. And I usually have to reiterate that vaping does include nicotine exposure as well. Although you don't have the adverse effects of smoke exposure, it increases your risk of insulin resistance, your blood pressure, causes adverse outcomes from a cardiovascular standpoint. And, it's really never too late to work on smoking reduction. There are a number of associated risk reductions that you can emphasize, but one thing I like to point out is just within 1 year of stopping smoking, you can have your risk of a heart attack, almost have your risk just at 1 year. And so even if you've been smoking all of your life, the benefits, the day that you stop smoking, you have immediate benefits.
Things begin to get better.
Your heart rate starts to normalize, your blood pressure starts to normalize, and then the cardiovascular risk almost immediately begins to decline. And so I often have that conversation with patients that have been smoking for a while or decades maybe, and I just remind them that there's still significant benefit even if we just start tomorrow.
And as a physician, you have, valuable information on how they can quit. You're not in it alone.
No, and there's so many pharmacotherapies that can help, and non-pharmacotherapy measures too. So I think the biggest thing is just trying to partner with your patients and keep them motivated and continuing to have that conversation. And again, reiterating that it's not too late, that even if you've been smoking for decades, it's not a lost cause. The damage, yes, you have some increased risk from that exposure, but you really can start to reverse a lot of those risks in a pretty short amount of time, which I think is reassuring and motivating.
That's exciting.
Yeah.
It is. It's encouraging.
Yeah. Diet is another thing I was going to kind of emphasize. That's a conversation I have with patients. So the American Heart Association really emphasizes a Mediterranean diet, which I think is a more fun way of thinking about how to improve our diet rather than just telling patients to eat more plants and vegetables and stop eating processed foods. So a Mediterranean diet, you can, look at online or buy books that kind of give you a lot of fun ideas that are
there's quite a bit out there.
Mediterranean inspired. Yeah.
Yeah.
Fish, it's going to focus on your healthy fats like fish, olive oils, legumes, and lower saturated fat diet too. There's known cardiovascular benefits with incorporating that into your diet. Patients a lot of times are really reluctant to start medications for their cholesterol, especially if it's kind of blindsided them. They've otherwise been healthy, and now they're being told that, your cholesterol is actually really putting you at increased risk, and we should talk about starting medication. And so in that case, we take our time. There's not necessarily, immediate urgency to starting medicine. So I usually kind of let that marinate, but also talk about lifestyle measures, of course. But sometimes I find that, instead of, again, just saying, let's work on eating healthier, eating more fruits and vegetables, I like to kind of give more specific ideas. And so
a plan of action.
Yeah. So one thing I'll talk about is just soluble fiber. If you can incorporate soluble fiber into your diet in the form of For example, oatmeal. Maybe you have oatmeal or oat bran into your breakfast instead of whatever else you may have been having for breakfast. That can reduce your bad cholesterol, your LDL, by 10 to 15%. And by doing that and incorporating beans and legumes into your diet, nuts. And so I try to give a little bit of specific ideas, because sometimes patients will say, oh, actually, I like oatmeal, or I do like beans. And so then it starts to feel a little bit more accessible and feasible to sort of incorporate these things into their diet and routine, and make them feel like they have some ability to affect their cholesterol. That's not just, well, you're
here's
starting
a plate
medicine.
of lettuce, and just that's it. Forget that, all the things you love. So that's diet is probably exercise, diet, smoking cessation, sleep. Sleep is another thing that I like to really reiterate. Yes.
And it's probably something most of us are not getting enough of.
It's a problem. A lot of people, are dealing with, I've seen it. I've read the articles. I've seen the research, but also just people I know. Yes.
And we know that, stress, and there's a lot more kind of appreciation on the effects of chronic inflammation and chronic stress on the cardiovascular system. And sleep is really the opportunity for the body to repair itself and respond to those kind of inflammatory insults. And so reminding patients that, making sure you're getting an adequate amount of sleep is actually associated with 5 years additional life expectancy based on some studies. And so you really can't overstate the importance of making sure that you're sleeping enough and that you have a good kind of sleep routine, because long-term sleep deprivation is just not good for our bodies. So those are the lifestyle measures that I try to talk about with patients when they want to hear about, well, what can I do that's, I don't want to talk about just starting up 5 different medications today. I want to talk about things that I have control over on a day-to-day basis. So.
And I think that's great, too, that there are so many things you can do that don't involve just getting a prescription.
They really are.
Dr. Fish-Trotter is a cardiologist and works with internal medicine at Ascension St. Thomas. It's been a pleasure talking to you, and I can imagine that your patients like you very much.
I hope so. I love taking care of them. So
I think you really have just this warm ability to convey important information, but to do it in a way that I think, if I was having cardiology problems, I'd give you a call.
Well, thank you. Thanks so much for having me. And again, at such an opportune time during our Go Red for Women month. So
that's right. Wear red and tell everybody why.
Yeah. All
right. This is Made in God's Image, taking care of the body, mind, and soul that God gave us. Nashville Catholic Radio, which is at 100.5 FM, and also streaming on the Nashville Catholic Radio app, free wherever you get your apps, and also streaming at NashvilleCR.com. Thank you so much for joining us, and have a great February.
Thanks, you too.
Hail Mary, full of grace, the Lord is with thee.
This is Nashville Catholic Radio. People just like you listen to Nashville Catholic Radio.
On this episode of Belonging, the show for young Catholic adults.
100.5 FM and streaming on the free Nashville Catholic Radio app.
I went back to Vanderbilt and started fasting and praying.
Hello, I'm Bishop Mark Spalding of the Catholic Diocese of Nashville.
The Patrick Madrid Show on Relevant Radio.
Nashville Catholic Radio, 100.5 FM and streaming on the free Nashville Catholic Radio app.